Fentanyl, a word that has become all too familiar in news headlines due to its role in the opioid crisis. But what exactly is fentanyl, how does it work in the body, and why is it so dangerous? Let's break it down and explore the facts behind this powerful substance. Fentanyl is a synthetic opioid, which means it's made in a lab rather than derived from the opium poppy plant like heroin or morphine. It's primarily used in medical settings to treat severe pain, often for cancer patients or after surgeries, but it is also illegal when it's sold on the black market. In fact, fentanyl is up to 100 times stronger than morphine and about 50 times stronger than heroin. In 2020, fentanyl was responsible for over 60% of all opioid overdose deaths in the US, a stark indicator of just how potent it can be. Fentanyl works by binding to opioid receptors in the brain and nervous system. These receptors are responsible for controlling pain and emotions. When fentanyl attaches to these receptors, it can block pain effectively, trigger feelings of euphoria, and slow down breathing, which is the primary cause of overdose deaths. When taken in high doses or combined with other substances, fentanyl can overwhelm the body's ability to function, leading to respiratory depression, the slowing or stopping of breathing. This is often fatal. Fentanyl is so potent that a dose as small as 2 milligrams can be lethal for most people. Fentanyl is extremely dangerous because even a small miscalculation in dosage can lead to fatal consequences. It is also often mixed with other drugs like heroin, cocaine, or methamphetamine without the user's knowledge. This makes it incredibly easy to accidentally overdose, as users don't know the strength of the drug they're taking. From 2013 to 2016, fentanyl-related deaths increased by over 500% in the United States. The rise in fentanyl-related overdose deaths has made it the leading cause of opioid fatalities. Fentanyl's availability on the black market is one of the primary reasons for its increasing role in the opioid crisis. Illegal fentanyl is often made in labs, primarily in countries like China and Mexico, and smuggled into the United States. Drug traffickers often cut fentanyl into heroin or other substances, increasing the potency of the drugs without the buyer's knowledge. This practice has contributed to the skyrocketing overdose rates. In 2020, the Drug Enforcement Administration (DEA) seized over 9,000 pounds of fentanyl, a significant increase from previous years. An overdose from fentanyl typically occurs when someone's breathing slows down or stops completely. When the body is overwhelmed by the drug, it cannot process enough oxygen, which can lead to death if not treated immediately. Overdose symptoms of fentanyl include slow or shallow breathing, bluish lips or nails, loss of consciousness, pinpoint pupils. In 2018, fentanyl was involved in over 67,000 overdose deaths in the United States alone. The good news is that naloxone, also known as Narcan, is an opioid reversal drug that can save lives in the event of a fentanyl overdose. Naloxone works by rapidly binding to opioid receptors, reversing the effects of the opioid, including respiratory depression. However, because fentanyl is so potent, higher or repeated doses of naloxone may be required to fully reverse the overdose. According to the Centers for Disease Control and Prevention (CDC), naloxone has been used to reverse over 200,000 opioid overdoses in the U.S. since its widespread distribution began in the mid-2010s. While fentanyl remains a major threat, there are ways to combat the crisis. 1. Education. Increasing public awareness about the dangers of fentanyl and its presence in illegal drugs. 2. Naloxone access. Ensuring naloxone is available in communities, schools, and public spaces. 3. Policy changes. Stricter regulations on the manufacture, distribution, and sale of fentanyl. In 2020, over 1.2 million naloxone kits were distributed across the U.S. to combat opioid overdoses, including those from fentanyl. Fentanyl is a powerful and dangerous drug that has contributed to a devastating public health crisis. Understanding how it works in the body, why it's so deadly, and how we can respond to overdoses is crucial in our fight to reduce its impact. If you or someone you know is struggling with opioid use, help is available. Stay informed, stay safe, and let's work together to address the fentanyl crisis.